To this episode of Natty or Not, presenting my lab work. I did this at LabCorp about a month ago, and we're going to go through just part of it here. It's going to be a first part of the series, focusing on the hormone aspect. We start with the luteinizing hormone and the follicle stimulating hormone. These are basically good indicators whether I have natural ability to produce testosterone. Testosterone replacement will suppress FSH and LH. So this is a good indicator whether someone's natty or not. My levels here are pretty natty. The next levels we're going to look at is the big ones, free testosterone and total testosterone. So I have here a total testosterone of 861 and a free testosterone of 16.2. And I feel that way too. I feel pretty great drive, great energy, focus. Pretty easy to maintain muscle, build muscle. So this is pretty much what you'd expect from, a natural. It's above, 900. I don't know if it's natural at that point. So I think this is as best you can do as a natural. Let's talk about sex hormone binding globulin. This is another good indicator whether someone's natural or not. You'll see this, I've seen this pretty commonly in my patients who have insulin resistance, obesity. They'll have an abnormal sex hormone binding globulin. They'll also more likely be having some fatty liver disease, NAFLD, or they're using some medication. We also see that there's an inverse relationship between this as people age. So this is something we look at as well. Next we're going to look at is estrogen, right? Estrogen, yeah. Estrogen is next slide if my computer will cooperate here. Yes, so estrogen, men need this as well, but most of the time I'm seeing too much estrogen in men. So this is something we monitor, right? Obviously we don't want to crush it into oblivion, right? Estrogen helps us against bone fractures, it helps our sex drive, but excess estrogen, gynecomastia, so the man boobs, right? But we can just monitor this in our men, right? Because we can use aromatase inhibitors. We can use natural aromatase inhibitors, quercetin, resveratrol, zinc, progesterone, which we're going to get to a little bit later. And we can also use pharmaceutical grade and herbal supplements as well. Progesterone is a bit of a forgotten hormone in men. It's not really quite clear what progesterone does for men, but it does have some neuroprotective qualities to it, so we don't want this one low either. Let's move on here, see what else we have. Dihydrotestosterone, this one, pretty important one. As you're maturing from boy to man, you need dihydrotestosterone, right? After that, it's not so critical. If you have too high DHT, you're going to have hair loss, you're going to get a large prostate. We don't want it crushed into oblivion, obviously. It's the more potent form of testosterone, which testosterone gets converted to. This helps with sex drive and so forth. But we don't want too much of this. And, that's why I also monitor prostate in my men who are on testosterone replacement therapy, because DHT and prostate enlargement, they go together. But if you're good about doing your labs, you should never have a problem with this, right? We can use things like saw palmetto, 5-alpha reductase inhibitors like finasteride, zinc. So, no reason to have an elevated DHT. Can be treated. DHEA, also known as the anti-aging hormone. At these hormone conferences I go to, they talk a lot about DHEA. It's actually over the counter in the US. In other countries, it's actually a controlled substance because it's that powerful. It's a precursor hormone. Excess DHEA is associated with hirsutism, specifically in women, more hair growth, not something that women always want. We use this as an anti-aging hormone replacement therapy for men who maybe don't need testosterone or don't want to do testosterone yet. We want to try maybe some DHEA. Obviously, it's not going to be as potent as just doing testosterone replacement, but it's a pretty easy one to do. Doesn't really have a whole lot of side effects or risks, and it decreases as we age. So naturally, the anti-aging community is using this to help counteract some of the negative diseases with aging. Right, it's anti-atherogenic. It lowers serum triglycerides. It's immune supporting. Pro-hormone to all the sex hormones, libido enhancing. So a lot of good reasons why you'd want to use DHEA. The last one we're going to talk about is insulin-like growth factor 1, IGF-1, growth hormone, right? Everyone knows about growth hormone. And we monitor this at Iron DPC because there is such a thing as adult growth hormone deficiency, and it's associated with sarcopenia, osteoporosis, right? A lot of these common things we associate with normal aging, right? If a patient has low IGF-1 and they have some of these abnormal diseases of aging, we can give them hormone replacement. We can give them Omnitrope. We can do any sort of growth hormone to help support them and possibly reverse these normal diseases of aging, right? So that's what we do here. I hope you guys enjoyed this lecture on my hormone panel. My hormone panel is done at LabCorp serum, mind you. I'll probably be doing some salivary hormones at some point to compare those to serum. And stay tuned for my next episode on the rest of my lab because it's quite extensive. Talk to you soon.